Tanzania stands at a crossroads in its journey toward reproductive health excellence, and the decisions made today could either safeguard its hard-won progress or jeopardize the well-being of future generations. But here's where it gets controversial. A proposed Memorandum of Understanding, MoU, with the United States, part of the America First Global Health Strategy, has reproductive health experts sounding the alarm. While the document remains shrouded in secrecy, regional specialists fear it could impose restrictions that limit access to vital reproductive health services and information. And this is the part most people miss: the potential ripple effects could be devastating, particularly for women in rural areas. The MoU represents a shift in U.S. foreign aid policy, moving away from NGOs and international agencies toward direct bilateral agreements with recipient governments. While this approach may streamline funding, experts argue it risks sidelining scientific and medical priorities in favor of political agendas. For instance, in countries where similar agreements have been implemented, service providers have reported confusion, reduced public health education, and a chilling effect on doctors' willingness to offer comprehensive care. Dr. Moke Makoma, resident director of Engender Health Tanzania, warns that signing this agreement could lead to increased unintended pregnancies, unsafe abortions, and maternal deaths, placing an unbearable burden on an already strained health system. Here's the bold truth: reproductive health is not a political bargaining chip, it's a cornerstone of national development, community resilience, and human dignity. The World Health Organization, WHO, and the United Nations, UN, recognize family planning as one of the most cost-effective public health investments, with every dollar spent saving up to $6 in emergency healthcare costs. Yet, restrictive conditions in the MoU could reverse Tanzania's remarkable progress, including improved access to family planning, heightened community awareness, and strengthened emergency care capacity. Consider this: treating complications from unsafe abortions is exorbitantly expensive, costing between $45 and $100 per patient, depending on severity. With over 66,000 women treated annually, and thousands more unable to access care due to distance, cost, or stigma, the stakes couldn't be higher. Tanzania's large youth population further underscores the urgency of providing accurate information and youth-friendly reproductive health services to ensure social and economic stability. But here's the counterpoint that sparks debate: some argue that direct bilateral agreements could enhance accountability and efficiency in aid distribution. However, experts counter that such agreements must align with Tanzania's unique needs and priorities, not undermine them. An anonymous member of parliament stressed, "Any international agreement must respect our sovereignty and build upon our achievements, not dismantle them." The challenges are stark. Nearly 1 million women in Tanzania experience unintended pregnancies annually, with 40% ending in abortion, often under unsafe conditions. Between 16% and 19% of maternal deaths are directly linked to unsafe abortions, a grim reminder of the human cost of inadequate access to reproductive health services. The unmet demand for family planning, with 1 in 4 married women lacking access to modern contraception, exacerbates this crisis. For adolescents, the barriers are even more daunting, with stigma, fear of judgment, and limited youth-friendly services leaving their needs unaddressed. As Tanzania navigates this critical juncture, experts urge transparency, broad stakeholder engagement, and rigorous impact assessments before any agreement is signed. The question remains: will Tanzania protect its reproductive health gains, or will it succumb to external pressures that could erode decades of progress? What do you think? Is this a necessary trade-off for international aid, or a dangerous compromise of public health? Share your thoughts in the comments. This conversation is too important to ignore.